Hello, and welcome to Chapter 16 Medication and Electrical Therapy Review for Chapter 16 tests. Just make sure you go back over and read up on medication and anti-arrhythmic medication and how it affects the action potential, how different medicines affect the action potential. Also, my papers are sticking. Also, make sure you know what antiarrhythmic medication or how they're broken down into different classes. Make sure you know what belongs in class 1, and that class 1 is broken down into 3 different subclasses: class 1A, class 1B, and class 1C. Then you have class 2, which is your beta blockers, class 3, which are your potassium channel blockers, and class 4, which are your calcium channel blockers. Make sure you understand this particular note because it is highlighted. When the body gets an overdose of calcium channel blockers, a supplement of calcium is given to correct the low levels of calcium that your body is not getting due to the fact that you're on a calcium channel blocker. Also, you need to remember other antiarrhythmic medications. Emergency cardiac medications such as atropine, epinephrine, dopamine, all these medications, sodium bicarbonates. Also, that oxygen is given also. Oxygen. Make sure you know other medications that have EKG effects, meaning that they sometimes can affect your EKG reading, such as diuretics, bronchodilators, antihypertensive medicine, nitrates, glaucoma medication, erectile dysfunction medication, tricyclic antidepressants, illegal drugs can cause EKG differences, and anticoagulants can cause EKG differences. Also, read up on your electrical therapy. Know that there are 2 kinds of electrical therapy. You have artificial pacemakers, either traditional or cardio resynchronization therapy, or you have cardioversion defibrillation. Know that pacemakers are used for when somebody has a bradycardia and that you might have a cardiac dyssynchrony effect. Know that pacemakers consist of 3 components. You have your pulse generator, your pacing lead, and your electrodes, which are placed at the tip of your pacing leads. Know that there are a few indications as to why pacemaker may be used. Also know that there are 2 different kinds of pacemaker. You have a temporary pacemaker, and you have a permanent pacemaker. And know that most of the time they're referred to as pocket generators. Also, make sure you understand your pacemaker terminology. Know what VADO means if it's the first letter. Know what VADO means if it's the second letter. And know what TIDO means if it's the third letter. So make sure you understand. Make sure you know what VVI pacemakers are and what they're used for and why would you get a pacemaker. Know what the options are for getting a VVI pacemaker. Make sure you know what a DDD pacemaker is and what they're used for. and that when you're getting a DDD pacemaker, that it provides 4 different options. Make sure you know what are the different ways a pacemaker can malfunction, which is failure to capture, failure to pace, or failure to fire, undersensing, and oversensing, and know understand what the differences are on those different malfunctions. Make sure you read up on problems with traditional pacemakers. Know what cardio resynchronization therapy means. And how do you get cardio resynchronization? What is the criteria for them? Know what electrical cardioversion is used for. Know when you would use a defibrillation. Why would you use it and when would you use it? And what is it for? And what are the different defibrillators that they have? Monitor defibrillator, AICDs, and AEDs. And these are the different pictures. Also make sure that you also learn about hypothermia therapy. What they do with hypothermia therapy, basically they would put the patient in a cold bath to drop down their body temperature to kind of relieve some of the stress that the heart would go through. And that the only problem with hypotherapy therapy is the warming up process, that the patient can go back into cardiac distress if the warming process is not handled properly or is not monitored properly. If you have any questions after listening to this review, please feel free to text or send me a message and I will clear up anything for you. Good luck on Chapter 16 test, and I'll talk to you soon.